So to kick off, Kim, would you tell us a little about yourself?
My name is Dr. Kimberly Green. I lead PATH's global primary healthcare program, and that's really inclusive of a life course approach. So, really thinking about the needs for screening and prevention and treatment for NCDs, but also thinking about infectious diseases, thinking about maternal newborn child health, sexual reproductive health. And at the same time, we also focus on health systems. So, health financing is a major priority, but also supply chain, human resources for health, data as well. So, quite a comprehensive program that I oversee.
Fantastic. Thank you so much.
Yeah.
And NCD financing seems to be something that a lot of stakeholders care about. For IFPMA, it's one of our 4 calls to action, together with enabling innovation, ensuring accountability, and driving implementation. And this is because we know that NCDs contribute to almost 3/4 of global mortality. Many of these deaths are premature, and yet there aren't enough resources to deliver on the NCD prevention, early detection, treatment, and care that is needed. So, in your experience, what is PATH doing through its primary healthcare work to integrate NCD financing, and where does this sit in the policy priorities for the NCD coalition?
Yeah, so as you'll know, with the Universal Health Coverage High Level meeting last year, and even before that, and certainly in response to the COVID pandemic, there has been so much reform that is underway across low and middle income countries and countries worldwide to really reanalyze how health resources are being applied to a whole host of healthcare areas, including for NCDs, because I think the clear recognition is that for NCDs, we think about, at least for global development and assistance, they've received 1% to 2% over the past total allocations for global health over the past 24 years. And so although NCDs are really make up the largest burden overall of all diseases and attributable mortality and morbidity, they're not receiving the kind of resources that is required in order to make sure that everyone living with an NCD is able to access a diagnosis and treatment. And really importantly, that we're putting in place all of the measures that can prevent NCDs in the first place. And so one of the key areas of work that the PATH is really focused on is partnering with governments and really understanding how health spending and allocations are flowing, how much is going to primary healthcare, working with local organizations who are advocating for greater resources that are flowing through primary healthcare. And why am I speaking to primary healthcare? Why does that matter so much? Well, we know that around 90% of all healthcare that people seek in their lifetime is through primary healthcare. And we also know that primary healthcare is the most cost efficient and also the greatest way in which to increase health outcomes, right? So it's so critical that primary healthcare is strong in order to be a foundation for better services for NCDs. So we look overall at health financing holistically, thinking about the whole pie in the health account. Is it enough? We know that in Africa, there was a commitment that 15% overall of budgets would go to health, the Abuja commitment. And thus far, there are only 2 countries that have been able to achieve that. And so there's more work to be done to allocate within available resources the percentage that goes to health. And within that, then really aligning with what's the morbidity for NCDs and what percentage of the health account does need to go to NCDs. But this requires good data. We need to have good data on actual occurrence or prevalence of specific NCDs. And this is a challenge. This is an area where there's been a long-term struggle. But this is also an area where PATH has played a significant role in supporting governments to get a better sense of what is the overall prevalence of diabetes or hypertension, for example, and what should be the commensurate level of investment. So to answer your question about the NCD coalition, so this coalition was formed in 2017 and focuses on access to essential medicines and products and brings together governments, industry, academic groups, and also implementing partners, NGOs. really to think about like what needs to be done to address some of the supply side challenges to access some of the essential medicines and products for NCDs. And so a clear challenge related to that has to do with the financing equation. And you can know what medicines and products you need. You can know, hopefully, what the burden of disease is. But if you don't actually, have the ability to access those medicines through financing, then you're not able to implement an NCD program. So the coalition plays a significant role in forecasting related to essential medicines and products that are needed, looks at better ways to deliver care for those with diabetes, and is focused on financing overall for NCDs.
He must be very busy with both of these roles at the same time. I'm impressed. You mentioned the investment case, and also kind of we've heard this 1% to 2% ODA figure for a long time. One thing that IFPMA did is we commissioned new research, and we'll see if I can get this right, that if 1% GDP increase goes to total healthcare expenditure, where 40% of that goes into primary healthcare, there could be up to 5 million lives saved every year. What do we do to get that kind of domestic resource mobilization?
Yeah. So, I think there is no lack of data that shows the return on investment for investing in NCDs, right? So we know that there's for every $1 committed to preventing or screening or treating NCDs, there's up to a $19 return on investment. That is sizable. For a minister of finance, that's a great deal. However, I think somehow the messaging or reaching the right person at the right time isn't always happening. And for me, fundamentally, this translates into leadership. If leaders are committed to NCDs, if they really see the substantial impact that NCDs has on their populace, has on their health and well-being, but also their economic productivity, we should then see actions that are critical for changing the way in which investments are made in NCDs and really transforming the landscape, including thinking about universal health coverage, social health insurance, looking at making sure that NCDs are part of social health insurance, but also, better utilizing other levers like health taxes, right, excise taxes, or reducing subsidies that are maybe not the best place to use a subsidy, like for fossil fuel or for commodities like sugar. So there's many different ways in which financing decisions can be made in a different way to allocate the resources that are needed for NCDs. But it's got to be led from the top. And that's why with the high-level meeting this year, I think we have truly a golden opportunity. No doubt that high-level meetings are complex. No doubt that we don't get all the desired language that we want as part of the high-level meeting, but country leaders are coming and they will be making commitments. And so this is the opportunity then to continue the advocacy, continuing to ensure that there's accountability after the high-level meeting and increasing resource allocation for NCD services.
This is a great point. And I think because we're on the high-level meeting, I want to kind of turn to the NCD Coalition and a call to action. IFPMA is a really proud member of the NCD Coalition, and we know it's a huge year for NCDs. So what's one action we can all take to lead on NCDs in the next months?
Yeah, so it's an honor to have IFPMA as a partner and a founding partner as well since 2017. So in terms of the call to action, like the key step that the coalition could take, I think is very much in the NCD financing space, is being able to articulate key actions that are needed. And it's really crystallizing around three. Number one, clearly around increasing financing for NCDs, as I spoke to. And there's a variety of ways to do that, primarily through domestic financing. Number two, how do we increase efficiencies, right? And there are also a number of ways to do this. This can include increasing the enabling environment for volume guarantees for pooled procurement, ways in which we can defragmentize the essential medicines and products markets, because that in itself is a huge stumbling block. By being able to reduce the overall net cost to governments or to purchasers for NCD medicines, we reduce then, we basically then are able to increase the amount of resources that can be available for NCD services. And last, and very importantly, increasing accountability and transparency for how NCD spending is happening or not happening. And that means being able to understand what's being made available at the national level through national health accounts for NCDs, if there is an earmark for NCDs, and then where is it going? Where is it flowing through to? Does it make it to primary healthcare? And if so, is it actually translating into better uptake and access of services for people who need them? So that last piece is one that we as the coalition are going to be focusing on and developing some tools that community organizations and others can use to better track and keep governments to account in how they're following through with the high-level commitments, high-level meeting this year.
Fantastic. I'm really ready to join this effort, and I'm so glad that we have you as one of the leaders of this work. It's certainly time to lead.